Welcome back to the colorectal surgeon. I am Dr. Samrat Jankar, a board certified colorectal surgeon and fistula expert. Friends, when we get diagnosed with some perineal condition kind fistula, which is continuously having some kind of pain, irritation, pus discharge, and sometimes fecal matter discharge. And having diagnosed with fistula, many of the patients have always concern about sexual life, but they or their partner hesitate to ask about the question about the sexual life in a fistula-in-ano diagnosed, treated cases or surgery done cases. So let's dive into the topic, understand sexual life in fistula-in-ano patients. We know very well fistula is nothing but the abnormal tunnel in the perineal region which may have opening one, two or many outside. And having the fistula, there will be always some amount of pain and there will be some amount of perineal discomfort and active ongoing pus discharge is there will be a dirt and smell will be there, and also the hidden abscess, if it is there, patient will have continuous irritation and uncomfort. So they will be always concerned or their partner will be always concerned whether this fistula in ano is going to hamper our sexual life. Let's understand about the problem. Having fistula and its impact on the sexual life, it depends upon multiple factors. It depends upon what kind of fistula you are having. Is it inside the anus only? Is it having a transpintric fistula? It depends upon the severity. Is it the simple kind of fistula? Is it the complex fistula? Is it the associated with some kind of abscess? It depends upon the type of treatment you are going. Are you having the surgery undergone? Have you undergone the set-on insertion, or have you any other kind of surgical procedure you have underwent? It depends upon the stage of the disease. Is it the active abscess stage of the fistula? Is it the question says where fistula is dried up but there is a disease completely has not gone? So it depends upon multiple factor. The having fistula, the main concern will be pain and discomfort. The person who is having the fistula, the partner, will have a pain during the intercourse, and it depends upon the particular position and it depends upon the where fistula is lying and you are what kind of position you are having. Multiple factor, it depends. It's also impact the psychological impact in per se. The person having the fistula may always feel that it may affect their intimacy. At the same time, the partner, because of the pus discharge, because of the unhygienist, the next person partner may feel uncomfortable, it affect the intimacy. At the same time, persistent more pus discharge may be a reason for having the infection, active infection for your partner. That's all thing matters. So it depends upon multiple thing what actually going to have an impact on your sexual life. Many of the patient or their partner ask about whether to have sexual life is normal having the fistula. If you ask straight question, the answer is yes. It's an absolutely normal. It's not an something going to cause some major trouble. If you are mutually understanding, having a sexual life is not going to affect anything for the fistula. And because having the fistula and having the sex, is it going to affect anything? It's not going to affect. So you can have a natural life. It's not at all problem. But few of the things are important to know. The most important is the fistula before the surgery or after the surgery? If it is before the surgery, if pain is not there, active stage of fistula where pus is discharging, or you are having fever, tenderness is there, abscess is there, if not like that, as good as normal life you can carry out. A more important is the pressure. You need to have the position in such a way that too much of pressure on the fistula area should be avoided. And prior to your intimacy, you can clean that area, keep a hygiene so that partner will not feel uncomfortable because of the pus discharge. And also more important is heterosexual is more better, because the having homosexual there, anal intercourse if at all planning, it definitely going to be a disastrous for the fistula patient if at all the passive partner, the patient is passive partner. At the same time, if it is a post surgery, Usually, if at all we are going for the surgical treatment for the fistula, at least the period of healing that usually we call 1 to 1.5 month, having abstinence always help the patient to heal better. And during that course, whatever treatment, there are a lot of minimal invasive treatment and open surgical treatment, whatever we are going through, the fistula patient already has a psychological impact because of the pain of the fistula treatment. And also the person will be in the mentally disturbed, where there is ongoing trouble, discharge is there, dressing is there, cis baths are going on. In those scenario, the mental calmness which is needed, or mentally fitness is needed, that may not be. So usually avoiding 1 1.5 month is usually better. Post surgery, you can resume your normal sexual life. Once the fistula has completely healed, it's a better time to take a call for your normal routine sexual life. But most important is the partner should be very empathetic and very much caring for the patient, because the caringness, or what we can tell, the mental strength, if the partner gives, your sexual life remain as good as normal. But one most important thing is, having sexual life is not a issue, but anal sex for the patient having the fistula definitely should be avoided. You are having the fistula, and if I am a doctor, fistula expert, few tips I can give. It's always better, consult your surgeon, ask about the proctologist or colorectal surgeon about openly about this problem, so that they can guide, particularly in female. If it is anterior fistula which is there between the 11 o'clock to 1 o'clock and having the abscess, this deep perineum space hidden abscess will be there, it usually cause more trouble, more discomfort for the female, usually should be avoided. You should discuss with your surgeon about the condition, and also about having a sexual life. At the same time, having the proper positions also matters, so that excessive pressure not be generated over the fistulous area, so that pain and discomfort is less. If at all partner is going through the pain, in that scenario, application of local lignocaine ointment, and prior to your intimacy, if you can take a good cis bath for 5 to 10 minutes, usually help. And before the your intimacy, even you can clean and discharge, you can wipe out, you can clean the perineum, so that it may not going to make uncomfortable for your partner. The most important is, if you are having a fistula, it's always better treat it, because this is the one disease which is curable. If you have a good expert fistula surgeon, colorectal surgeon, visit them and get the opinion, treat it, cure it, so that your life, your intimacies, your sexual life is not going to be get disturbed because of this. And even in the post recovery, after 3 months also, even fistula heals, the scar will be there, it's not going to go in few days completely fistula wipe out and as good as normal perineum will become. It's not like that. The scar will be there. Because of the scar, some amount of induration, some amount of tenderness, some amount of pain the partner may have. It's better to take care empathetically, which I call, and have confidence over the person who has underwent the surgery, so that your life will become more easy and more better.